Have you ever finished a long day on your feet and found your shoes suddenly feel 2 sizes too small? Or maybe you tried to take off a ring at night, only to find it's completely stuck. That puffiness is what doctors call edema. While it might seem like you need to memorize a long list of diseases to understand it, the truth is much simpler. By the end of this video, you'll be able to look at any case of swelling and spot the exact mechanical breakdown that caused it. Physically, this swelling happens when fluid starts filling up the microscopic gaps between your cells. These tiny spaces are usually quite dry, but when they become waterlogged, the tissue expands. That extra fluid is a sign that your body's internal traffic system for water has hit a major bottleneck. To see how the system fails, we first need to see it working. Think of your tiniest blood vessels as a garden hose, the surrounding tissue as soil, and the lymphatics as a drainage grate. This chart shows how fluid moves between that hose and the soil. On the left side, the line for capillary pressure represents the pushing force of your heart. It is constantly nudging water out to keep your tissues hydrated. But look at the end of the line on the right. Even as the heart's push fades away, this dotted line remains steady. This represents the pulling force. It is powered by a protein called albumin, which stays inside the vessel and acts like a molecular sponge, magnetically soaking water back out of the tissue. This green tube is a drainage network that catches the small amount of overflow that doesn't get pulled back in. It sweeps up about 3 liters of excess fluid every day and returns it to your circulation. As long as the pusher, puller, and drain are in balance, your tissues stay perfectly dry. When you see swelling, it means one of 4 parts of that plumbing system has failed. The first failure is when the pusher force becomes too high. It's like blasting a garden hose too hard. Water is nudged out with so much power that sponges inside the vessel can't pull it back in fast enough. The second failure happens when the pulling force is too low. If those molecular sponges disappear from the blood, the water gets pushed out normally, but has no magnetic pull to bring it back home. The third failure is when the pipes get leaky. During an infection, the vessel walls can physically pull apart, allowing water and proteins to spill out into the gaps between your cells uncontrollably. Finally, there is the blocked drain. The push and pull might be working fine, but if the drainage network is obstructed, the overflow has nowhere to go and slowly pools in the tissue. Whether the cause is a minor sting or a major illness, it always triggers one of these 4 mechanical problems. This explains why people with heart failure get swollen ankles. Their heart isn't pumping blood forward effectively, so it backs up in the veins, creating a massive pusher force that drives fluid into the feet. It also explains why liver disease causes a puffy appearance. The liver is the factory that makes our molecular sponges. Without enough albumin, the body loses its pulling force, and water stays trapped in the tissues. Even local swelling fits the pattern. A bug bite causes leaky pipes, while certain surgeries can remove the drainage grates, leading to a blocked drain in that specific limb. To keep this straight, just remember, swelling is simply fluid trapped in those microscopic gaps between your cells. It happens because the pusher got too strong, the sponges disappeared, the pipes got leaky, or the drain got blocked. Edema is the physical result of water entering your tissues faster than it can be pulled back or drained away. If this visual approach helped you understand a complex topic, consider subscribing. We are making the most difficult parts of human biology simple and clear every week. Thanks for watching.